Healthy blood circulation is a fundamental requirement for maintaining mobility, tissue health, and overall quality of life, particularly in adults over the age of 60. As part of the normal aging process, several physiological changes occur that can affect circulation, especially in the lower extremities. These include reduced elasticity of blood vessels, decreased muscle activity, and lower daily movement levels. Because the legs are anatomically farthest from the heart, they are often the first area to experience symptoms related to reduced blood flow. Reduced circulation to the legs may present as heaviness, stiffness, coldness, numbness, muscle cramps, swelling, or discomfort during walking. While these symptoms can vary in severity, they often indicate that blood is not efficiently delivering oxygen and nutrients to the muscles and tissues of the lower limbs. One supportive and often overlooked strategy for maintaining healthy circulation is adequate hydration combined with natural, nutrient-rich beverages. Natural drinks made from water and plant-based ingredients provide essential fluids, vitamins, minerals, and antioxidants that support the body's circulatory function. While these drinks are not a substitute for medical treatment, they can contribute positively to vascular health when used consistently as part of a balanced lifestyle. Hydration plays a critical role in circulation. When the body is inadequately hydrated, blood viscosity can increase, meaning the blood becomes thicker and flows more slowly through the vessels. This effect is particularly noticeable in smaller or more distant vessels, such as those in the legs and feet. Proper hydration helps maintain optimal blood consistency, allowing it to circulate more efficiently throughout the body. In addition to hydration, natural drinks often contain compounds that support blood vessel function. Healthy blood vessels are more flexible and able to respond appropriately to changes in blood flow demand. With aging, blood vessels can become stiffer, which may restrict circulation. Nutrients found in natural, plant-based sources help support endothelial function, the inner lining of blood vessels, allowing them to relax and promote smoother blood flow. Improved circulation also enhances oxygen delivery to leg muscles. Adequate oxygenation is essential for muscle function, endurance, and recovery. When blood flow improves, patients may experience reduced fatigue, improved warmth in the lower limbs, and greater ease of movement. These changes are important for maintaining balance, walking ability, and independence in older adults. Another relevant factor is inflammation. Low-grade chronic inflammation is common with aging and can negatively affect vascular health. Inflammatory processes may contribute to narrowing of blood vessels and impaired circulation. Nutrients commonly found in natural drinks may help support the body's natural anti-inflammatory mechanisms, thereby promoting better vascular function and comfort in the legs. It is important to emphasize that natural drinks should be viewed as a supportive measure, not a replacement for prescribed medications or medical care. Individuals with diagnosed circulatory conditions, diabetes, or cardiovascular disease should always follow their healthcare provider's guidance. However, many clinicians encourage appropriate hydration and a nutrient-rich diet as part of a comprehensive approach to circulatory health. Some individuals may notice mild improvements, such as reduced stiffness or a sensation of warmth in the legs, within a short period after improving hydration and dietary habits. While these early changes are subtle, they can indicate improved circulatory activity. Long-term benefits depend on consistency rather than immediate results. Lifestyle factors further enhance these effects. Light physical activity, such as walking or gentle leg exercises, help stimulate blood flow through the lower extremities. Hydration and nutrition support the quality of blood and vessel health, while movement encourages circulation. Together, these factors work synergistically to support lower limb vascular function. Conversely, excessive intake of sugary or highly processed beverages may contribute to dehydration, inflammation, and impaired circulation. For older adults, replacing such drinks with natural, low-sugar alternatives is a more favorable option for vascular health. In conclusion, supporting blood circulation in the legs is essential for maintaining mobility, comfort, and independence in older adults. Adequate hydration and the regular use of natural, nutrient-rich drinks can help support healthy blood flow by improving blood consistency, supporting vessel flexibility, reducing inflammation, and enhancing oxygen delivery to the lower limbs. When combined with light physical activity and appropriate medical care, these measures form a practical and responsible approach to maintaining leg health with aging. Adequate blood circulation to the lower limbs is essential for maintaining mobility, stability, and overall functional independence, particularly in adults over the age of 60. Blood flow plays a central role in delivering oxygen and nutrients to muscles, joints, and nerves. When circulation to the legs is compromised, even routine movements such as walking, standing, or climbing stairs can become difficult and uncomfortable. Over time, these symptoms can discourage physical activity, leading to further muscle weakening and reduced balance. This creates a cycle in which limited movement worsens circulation, and poor circulation further limits movement. When circulation improves, the effects on mobility are both measurable and meaningful. Improved circulation enhances oxygen delivery to leg muscles. Oxygen is required for muscle contraction, endurance, and recovery. When muscles receive adequate oxygen and nutrients, they are able to perform more efficiently and fatigue more slowly. As a result, individuals may experience increased walking endurance, smoother movement, and less discomfort during daily activities. Better blood flow also supports nerve function in the lower limbs. Nerves rely on consistent circulation to transmit signals between the brain and muscles. Poor circulation can contribute to numbness, tingling, or reduced sensation in the feet and legs, which negatively affects balance and coordination. Improved circulation helps support nerve health, which can lead to better awareness of foot placement and improved stability while walking. Balance is a critical factor in preventing falls, one of the most serious health risks for older adults. Stable circulation supports the muscles and sensory systems involved in posture and balance. When blood flow is optimized, leg muscles respond more effectively to changes in position, such as standing up, turning, or stepping onto uneven surfaces. This responsiveness directly contributes to greater confidence in movement. Confidence is an often underestimated but highly important outcome of improved circulation. When individuals feel that their legs are strong, responsive, and reliable, they are more likely to remain physically active. This confidence encourages continued movement, which further supports circulation and muscle strength. In contrast, fear of pain, weakness, or instability can lead to avoidance of activity, accelerating physical decline. Improved circulation also contributes to joint comfort. Blood delivers nutrients to the tissues surrounding joints, including muscles, tendons, and ligaments. When circulation is insufficient, joints may feel stiff, especially after periods of rest. Enhanced blood flow helps maintain tissue flexibility, which can reduce stiffness and improve range of motion in the hips, knees, and ankles. From a clinical perspective, maintaining mobility is closely linked to long-term health outcomes. Regular movement supports cardiovascular health, muscle mass, bone density, and metabolic function. Improved leg circulation enables individuals to stay active longer, which has protective effects against many age-related conditions. It is important to note that improvements in mobility do not require intense physical activity. Even modest increases in circulation can make daily movements feel easier and safer. Activities such as walking short distances, rising from a chair, or performing gentle leg exercises become more manageable when blood flow is adequate. Hydration, nutrition, and light physical activity work together to support this process. While nutrition and fluids help maintain blood quality and vessel health, movement helps circulate blood through the lower extremities. This combined approach is widely recommended in clinical and preventive health settings. Improved mobility also has psychological benefits. The ability to move independently supports mental well-being, reduces stress, and enhances overall quality of life. Seniors who feel capable and stable are more likely to engage socially, stay active, and maintain a positive outlook on their health. In summary, better blood circulation in the legs directly supports improved movement, balance, and physical confidence. By ensuring that muscles, nerves, and joints receive adequate oxygen and nutrients, healthy circulation allows older adults to walk more comfortably, move with greater stability, and maintain independence. Supporting circulation is therefore not only a matter of physical comfort, but a key component of healthy aging and long-term mobility.